Okay. Hi Sam, how are you today?
Good, how are you?
Good. My name is Marta. I'm your student physical therapist assistant. What we're going to do today is get some stretches going. We're going to practice your balance. We're going to strengthen that lower extremity. Now what that's going to require me to do is place my hands around you, put the gait belt around you. Do I have your permission to do so?
Yeah.
Okay, perfect. I'm going to hand sanitize my hands. Nice and clean. Okay, now I am aware that you are a fall risk, and I just also want to give you a heads up. Every time we're going to be moving off the bed onto the vanity, we're going to watch out for shearing forces, okay? Throughout the whole exercise as well. We don't want to hurt that leg. So what I'm going to do first is I'm going to start off with strengthening. Now I know your hip abduction grade is a 2 out of 5. So what we're going to do is we're going to try to do some neuromuscular re-education, okay? So what I'm going to ask you to do with my hand fully open, and then you let me know if there's any pain, aches, or anything. I'm going to push over here, and you're going to give me a max ISO. So what you're going to do is you're going to push against my hand as hard as you can, okay? Good. And then we're going to count to 5 seconds.
1, 2, 3, 4, 5.
Okay, relax for me, and we're going to do that 9 more times, okay? We're going to do that once at a time. Okay?
1, 2, 3,
Now,
4.
what this is doing is we're practicing neuromuscular re-education. What we're trying to do is we're trying to get the muscle fibers of the quad, or of the hip abductors, to start firing faster, stronger, more properly, so that she's able to get out of gravity eliminated movement and into gravity movement. You doing okay? All right, nothing hurts?
Nope.
My hand placement over here is okay? Okay, let's do 6 more.
1, 2, 3, 4, 5.
Okay, 5 more.
1, 2, 3, 4, 5.
Okay, 4 more.
1, 2, 3, 4, 5.
Okay, relax. 1 more.
1, 2, 3, 4, 5.
Still doing okay? Doesn't hurt?
Yeah.
Okay, let's do 3 more.
1, 2, 3, 4, 5. 1, 2, 3, 4, 5.
Okay, 2 more.
1, 2, 3, 4, 5.
Okay, 1 more.
1, 2, 3, 4, 5.
Okay, now in order to regress this exercise, what we would do is instead of doing a max isometric, we would do a submax isometric. So the patient would only push slightly into my hand and not fully as possible. So let's do that. Okay, push, and then we're going to do 1 set of 10 for 5-second holds also.
1, 2, 3,
Good.
4, 5.
Okay.
1, 2, 3, 4, 5.
Okay, and we would do that 8 more times. And in order to progress this, because it's too easy, what we would do is we would actually ask the patient to lie on their side. So Sam, I'm going to ask you to lay down on your right side. Make sure you are avoiding those shearing forces, so pick up that leg. Good. Okay, lay on your side. Okay, now she's able to do this because we progressed. So we're going to be here, and we're going to give her an isometric. So lift up that leg. Okay, count to 5.
1, 2, 3, 4, 5.
And we would do that 1 set of 10. Okay, one more time.
1, 2, 3, 4, 5.
And again, working those hip abductors, okay? Sam, let's move on to your next exercise. We are going to do a stretch for your hip flexors, okay? So what I'm going to ask you to do is I'm going to ask you to lay on your stomach, okay? Remember we talked about how to do bed mobility. So what I want you to do is I want you to roll over on your tummy. Watch out for those shearing forces on that lower extremity. Good. Okay. Now, I'm going to remove the pillow. You doing okay? Okay. Now, what I want you to do is I want you to prop up on your elbows, okay? Good. And count to 30 seconds. Now, what this is doing is it is actually stretching her hip flexors her iliopsoas. She was tested positive for the Thomas test, meaning that those are tight. And we want to keep her in this position 3 times for 30-second holds. So count to 30 for me. We're going to do this 3 times, okay? Okay, count out loud.
1,
Now what we're
2,
doing here is
3,
we are working on
4,
elastic to plastic
5,
deformation.
6,
There should be results within 6
7,
weeks. What happens
8,
is
9,
that the muscle fiber
10,
gets more collagen in it, and once
12,
it gets more collagen, it becomes more elastic, and then that
14,
plastic deformation
15,
occurs,
16,
so that we have that nice stretched out
17,
muscle and it's not tight
18,
anymore.
19, 20,
You doing okay?
21,
Good.
22, 23, 24, 25, 26, 27, 30.
Okay, and then lay down on your tummy, and you're feeling that stretch in that muscle right over here?
Yes, I do.
Okay, good. Now let's do that 2 more times, and count to 30 for me.
1, 2, 3, 4, 5, 6,
You
7,
doing okay? Doesn't hurt?
8,
Good.
9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, and then again, go on your stomach. Now, if this was too hard for the patient, what we would do is we would just have her laying prone like this, 3 times 30 seconds again, and in order to, so she would be laying here for 30 seconds, and to progress this, we would have the patient fully extend. So Sam, what I want you to do is I want you to fully extend your arms. So no, we're gonna go to, so we're gonna go into the elbow, and then you're gonna kind of like do an extension, like a press up, kind of like a push up, all the way up with your arms. Good, okay, and then count to 30.
1,
And again, we would do
2,
this 3 times 30 seconds.
3, 4, 5,
Giving that hip flexor and the iliopsoas a better
7,
stretch.
8, 9, 10, 11, 12, 13, 14, 15, 16, 19, 20,
You doing okay, Sam?
21,
Good.
22, 23,
And then again, we're
24,
avoiding those shearing forces. We're
25,
making sure that there's no discomfort in the incision or in the area.
28, 29, 30.
Okay, good job. All right. Now what we're gonna do, Sam, is we're gonna go over by your vanity and we're gonna brush your hair just to practice your balance, okay, so that it gets a little bit better. So again, as we talked last time, let's get you up off of the bed. So what you're gonna do is turn towards me, and we're gonna get you on your back. Okay, good. All right, now let's sit you up. All right, perfect. Let's swing that leg over, making sure you're not dragging it on that mat. And I'm gonna put the skate belt on you just for safety, okay?
Okay.
Alrighty. Nice and snug. Okay, good. Let me just readjust the camera. Okay, so here is the vanity. And this is gonna be your hairbrush, okay? So I'm gonna have you stand up. Good. Okay, now let's go over to the vanity. Perfect. Let me just readjust the belt. Okay, now with one hand, I want you to hold your arm to yourself. Good. And then obviously the vanity is a little bit too small for her size, but in reality, she would have a bigger one, so she's not leaning over. Good. So hold on to the patient. Pause. Okay. Alrighty. So I am going to be standing on the patient's amputation side. Okay. Good. Now I want you to reach over this way, and I want you to grab your hairbrush, and I want you to brush your hair. Okay. Good. And let's put it back. Good. And let's pick it up again. Alright, now we would do this 2 times for 1 minute. So what we're doing here is we are working on ankle strategy, we're working on hip strategy. we are, the perturbations of reaching out of her base of support are sending signals to sending sensory input to the central nervous system for better motor output. Okay, good. And after we are done with the 2 times for 1 minute, it looks like it's too hard for her, so we are actually going to regress this. So what we're going to do is we're just going to bring the hairbrush to her base of support, and we're just going to have her pick it up and not challenge the center of gravity as much. And then again, we're going to do it 2 times for 1 minute. Okay, and progress it because it appears to be too easy. We're going to ask the patient to let go of her upper extremity. So she's going to be reaching out of her base of support, and she's not going to be holding on. Good. And we're going to do this 2 times for 1 minute. Okay. All right, now that we're done with that exercise, let's come on over by the bed. I'm going to, good. And sit down. Okay. All right, Sam, how did you think that went?
Good.
Good, okay. I think you're really improving with your balance. I think if we work on it a little bit more, we'll be able to use your assisted device, go to the bathroom, just so that we can start teaching you how to brush your hair, so that eventually you can start doing that all by yourself. Or brush your teeth, I'm sorry. We're just going to continue doing those stretches, continue to straighten that leg for that prosthetic. Do you have any questions for me?
No.
Anything you want to work on?
No.
Okay. All right. It was nice working with you. I will see you tomorrow.
Okay, thank you.